Assalamu alaikum peeps, how you all doing today? Back in the green scrubs from the pleb student? Yeah, back in it. It's been an interesting week of seeing patients and talking to them again. I'm in A&E again, so I just wanted to share with you a few more stories because why not? So yeah, how you all doing first and foremost? Hope you're having a wonderful day. But I just wanted to share with you guys a quick sort of phrase that has been going through my mind ever since I've really been taking more and more interest in practical application of what the clinical skills that we have learned in medicine. And one common theme that's been going through my mind recently is overcaring is careless. Now, what I mean by that? Sometimes when you focus on something too much and you want to make it perfect, thinking that if you don't do it perfect, you're going to be harming someone, maleficent towards a patient, not acting in their best interest, blah yada yada, ethics-wise, or even just in normal everyday life, how you deal with your friends, family, or your education. Overcaring and being over perfect, the perfectionist, can really be careless and detrimental to medicine and also how you apply yourself in life. Now, to put it in perspective, let me first and foremost put it into a story for you guys, an analogy, or sorry, an anecdote, not an analogy. We all have been through this situations where in medicine, in medical school, they will teach us clinical skills. They will put us in a room and the doctor will tell us, okay, here's the steps. You have to do this and this and this and this in this order. And if you don't do this, you could be putting the patient at this risk. And if you don't do this, you could fail your OSCE. And if you don't do this, it's bad. It's good information. It gives you steps and also the parameters you need to think about when you are dealing with a patient or dealing in your everyday life. When I'm talking about everyday life, for example, you set out a plan. I'll say, I will do this on Monday, this on Tuesday, this on Wednesday. And you set yourself a sterile plan of what you're going to do. Or if you're dealing with your friends and family, like, I will do this with my friend and this with my friend and make sure that I won't do this with them and that with them. Sterile is the key word here. These are all sort of perfect plans, sterile plans, overcaring plans. You've planned everything to the pinpoint, but that's careless. Because nothing in life really goes to plan. When it comes down to clinical skills, yeah, these steps, for example, let's put it into perspective. Cannulations or venipunctures, you have to have them in an OSCE. They have to go in a specific order. But in real life, you can't really do that. It's actually careless and detrimental to the patient. To put it to another perspective, a couple of days ago back in A&E, there was a kid who showed up with learning difficulties, and it was difficult to put a cannula in them. Why is that? Because he's in a strange environment, seeing strange faces. I know they want to put a needle that's painful inside of him. You can imagine the fear that he's going through. He is screaming and he is very resistive to the doctor trying to put a cannula in. Now, this cannula needs to be done quickly for two reasons. A, you don't want to delay his treatment, and B, you don't want to focus on him so much that you forget your other patients that could be going through detrimental problems, and you're risking other patients now by slowing down how fast you get the cannula into this patient. Now, if we went through this process in the exact steps that we got taught in med school of feel for the vein, rub the alcohol in, clean the area, then make sure that you put the gloves on, you put the tourniquet on, and you remember exactly where the vein is, bearing in mind the veins move about, and also that this patient is moving his arm all the way around. You will have to repeat these steps over and over and over again, because at one step you will have broken the sterile field. At one step the patient could have touched where you wanted to put the cannula in, whatever it is, these steps could be broken. And if you have to go all the way back to square one to start putting the cannula into this patient, you're wasting a lot of time. So what I saw the doctor is, yes, a cannula can be a very dangerous thing. It can cause infection, but at the same time you have to sort of weigh up how well this cannula is important to the patient, yes, but also what is the best way to put it in. Now, what do I mean by this? What I saw the doctor do is, there was a lot of doctors holding the patient down, sort of just not letting him move, but the vein wasn't really present. So what the doctor had to do is feel for it first, put on the gloves after he sterilized his hand, and also as he couldn't really see the vein again, he had to feel for it again with the gloves on. Now, this is a big no-no in OSCEs, but a big yes in real life. So even though this could have potentially broken down the sterile field on the patient's arm, it was needed so that you can get in the cannula as fast as possible and reduce the stress this patient was going in by spending less time with him trying to put a cannula in. It's a weird story, but all I'm saying here is don't follow everything to the plan, to the T. Now, why is this careless? As we saw here, it would have been detrimental to the patient and other patients the doctor was caring for. But here's how you can apply in real life. We all come out with plans saying that I'm going to do this specifically on this day, but it never goes right. Why? Because maybe you're struggling to understand something, so you have to go over and over and over again, so you didn't study everything you want to study on that day, or maybe something came up and what your plans for the day had to be adjusted. And also when it comes down to dealing with people, you will come up with an idea and a plan of how you will deal with people, but nothing is perfect. You can't people are weird and flexible. So you can't be overcaring on how you want to deal with people. Yeah, that's all I want to say really. So what does all actually mean for me and you? What I'm really trying to get across to you guys is, in medicine and in real life, you have to be flexible and how you approach everything. What we're taught in med school is not what we need to apply in real life. What we're taught in school and how to learn is not how we really apply it in real life. Humans are weird. Yes, we are creatures of habit, but we have to be extremely flexible. And you have to think to yourself, really, if something doesn't go to plan, just relax, lay back, and you know, just wing it. It's a weird story I'm telling you guys, but you know what? I hope it helps to relax all the minds. Now, the real reason I'm saying this is because I've just started my last stage of medical school, and it's been quite stressful trying to figure out how I want to study. You know, there is no clear plan on how I want to study, but then I realized just by observing all the doctors and what they're doing is I'm being overcaring, and that's careless, because now I'm just being stressed and I'm not really doing everything I can to learn properly. So what I'm going to do, just be flexible and wing it. So I hope that helps everyone else who's finding medical stressful and finding it stressful to find out how to study for it. So yeah, weird story, but I hope you guys enjoyed. I'll see you all in the next one.